Welcome to the Wisdom of Sex, where we break down the realities of sex and intimacy, no filter, no shame. I'm your host, Dr. Wisdom, and today we're exploring two topics that can be a bit uncomfortable to talk about, but important: painful sex and erectile dysfunction. If you've experienced one of these issues, your partner has, or you're just curious, this episode is all about shedding light on what's often kept in the dark. So get cozy on the couch and let's talk about the real challenges that impact our sexual health and how to overcome them. Let's jump into a topic that doesn't get nearly enough airtime: painful sex, or what's medically known as dyspareunia. It's something that affects a lot of people, but for some reason it's not talked about enough. Women in particular are often told or made to feel like it's normal to endure discomfort during sex, like, oh, you just have to push through it. But let me tell you, that is not normal. Painful sex is not something you have to just deal with. And if it's happening, there's likely an underlying reason. And it's not just a women's issue. Men experience painful sex too, but because it's less discussed, they often feel isolated or ashamed to bring it up. Pain is pain, folks, and it doesn't belong in the bedroom unless it's consensual and part of your kink. We'll save that for another episode. For men, one of the major culprits is Peyronie's disease. This is when scar tissue develops inside the penis, causing it to bend and leading to pain during erections and intercourse. There's also the possibility of infections or even prostate issues that can make sex uncomfortable. So if you're feeling a burning sensation or sharp pain, you're not alone, and you're definitely not broken. So why do people stay silent about painful sex? Well, a lot of it comes down to embarrassment and shame. Many feel like they're the only ones going through it, or that they're somehow less desirable or broken because of it. There's also the fear that bringing it up might create distance in their relationship, like, if I tell my partner sex is painful, are they going to lose interest? And I get it. Intimacy is such a vulnerable area, and talking about pain in the middle of that can feel really challenging. But here's the thing: pain during sex is not something you should ignore or push through. It's your body telling you that something is up and it deserves your attention. You wouldn't just endure a toothache or a sore knee without looking into it, right? Your sexual health is just as important as any other part of your well-being. Okay. So what can you do if you're experiencing painful sex? The good news is there are solutions, and it's definitely treatable. For women, one of the first steps might be pelvic floor therapy. Yes, that's a thing. A pelvic floor therapist can help you relax and strengthen the muscles down there, which can reduce or even eliminate the pain. Hormonal treatments or even surgery might be necessary depending on the severity for issues like endometriosis or hormonal imbalances. Don't hesitate to talk to your OB/GYN or a specialist who can help pinpoint the exact issue. Now for the guys, if you're dealing with Peyronie's disease, there are treatments available, including medication or even surgery to remove the scar tissue. It might feel weird to go to a doctor and talk about your penis, but trust me, they've seen it all. It's a medical issue, not something to be ashamed of. And, of course, this wouldn't be a proper sex talk without mentioning communication. Open up to your partner about what's going on. A lot of times, we assume that our partners will be upset or disappointed, but the truth is that a loving partner will want to help find a solution. Pain doesn't have to mean the end of your sex life. It's just a bump or maybe a bruise in the road. With the right help, you can get back to feeling comfortable and enjoying intimacy again. So here's the bottom line: pain during sex isn't normal, and you don't have to settle for it. Whether it's something physical like endometriosis or Peyronie's disease, or it's more about tension and stress, there are ways to address it. Your pleasure matters, and your body's comfort should always be a priority. Don't stay silent, don't settle, and definitely don't push through the pain. If you're experiencing painful sex, reach out to a healthcare professional, talk to your partner, and explore the treatments available. You deserve to have a fulfilling, pain-free sex life, and trust me, that's entirely possible. Okay, let's move on and talk about erectile dysfunction. First, let's break down a common misconception. Erectile dysfunction, ED, isn't just an old man problem. While it's true that ED is more commonly associated with aging, Younger men are experiencing it more than you might think. And no, it's not just a few isolated cases. It's becoming increasingly common for guys in their 20s and 30s to struggle with ED. This isn't just about the body slowing down over time. For younger men, it often has way more to do with what's going on above the belt. We're talking about the mind. But the myth that only older guys deal with this issue makes it all the more frustrating and isolating for younger men who might feel like something's wrong with them for struggling with it so early in life. For many men, sexual performance is tied to their sense of masculinity, self worth, and character. When ED occurs, it can feel like a personal failure, triggering a range of emotions like frustration, embarrassment, guilt, and shame. These feelings are often compounded by societal expectations that men should always be ready for sex, leading to heightened performance anxiety. As a result, ED is rarely just a physical issue. It's a multifaceted challenge that involves mental, emotional, and relational components. So, why is this happening to younger men? The causes of ED in younger men can be quite different from those in older men. For many younger guys, it's often psychological. Anxiety, especially performance anxiety, can be a huge trigger. It's a vicious cycle. Once it happens, you start worrying it'll happen again, and that stress makes it more likely to happen again. And then you're stuck in this loop of anxiety and avoidance. Depression is another big culprit. It's hard to feel sexy when your mind is clouded with negative thoughts or when your energy is completely zapped. Then there's the issue of body image. With social media and the rise of fitspiration, younger men are feeling pressure to look a certain way, and if you don't feel good about your body, it can absolutely mess with your confidence in the bedroom. And let's not forget about porn addiction. There's no shame in watching porn, but excessive consumption can lead to something called porn induced ED. This is where real life sex just doesn't seem to measure up to the hyper-stimulating, idealized version of sex portrayed in porn. Your brain gets so used to that level of excitement that regular intimacy can start to feel dull, making it harder, pun intended, to perform. Of course, there are physical factors too. Things like obesity, smoking, and poor circulation can contribute to ED at any age. But for younger men, it's usually a mix of mental and physical factors. Let's talk about the elephant in the room, the shame and embarrassment around erectile dysfunction. I mean, the pressure on men to perform sexually is huge, and when things don't go as planned, it can feel like a direct hit to your masculinity. The thought that you're too young to be dealing with ED can make it even worse. It feels like everyone else is out there having a great time, and you're stuck in your head, avoiding intimacy because you're afraid of what might happen. But here's the thing: ED is a medical condition. It's not a reflection of your manhood, and it's certainly not your fault. It's important to remember that just like any other part of your health, your sexual health deserves attention and care. Embarrassment only gets in the way of getting the help you need. The truth is, many men deal with it, but few talk about it. So, what can you do if you're dealing with ED? The first and most important step is to talk to a doctor. It can feel intimidating, but trust me, doctors have heard it all, and ED is more common than you might realize. Whether it's a physical issue, a mental one, or a combination of the two, there's no reason to keep suffering in silence. Therapy can be a game changer, especially if anxiety, depression, or relationship stress is contributing to your ED. Working with a therapist who specializes in sexual health can help you unpack those mental blocks. Sometimes just having an open, honest conversation about what you're going through can take a huge weight off your shoulders. If it's a physical issue, there's medication like Viagra or Cialis, which can help by increasing blood flow to the penis, making it easier to get and maintain an erection. But don't jump straight to the pills. Consult with a doctor to make sure they're right for you. Lifestyle changes can also make a big difference. Getting regular exercise, eating a balanced diet, and managing stress can improve your overall health and, in turn, your sexual function. Cutting back on alcohol, quitting smoking, and improving sleep can all have a positive effect as well. In my book, The Wisdom of Sex for Men, I mention some exercises, such as practice daily relaxation by incorporating stress-reducing activities like yoga, meditation, or deep breathing into your routine. Even 10 minutes a day can lower cortisol levels and reduce anxiety around sex. Try to create a pre-sex routine. If performance anxiety is a concern, create a calming routine before sex. This could include breathing exercises, listening to soothing music, or engaging in non-sexual physical affection to ease performance pressure. And lastly, mindful masturbation. Reduce reliance on pornography by practicing mindful masturbation. This involves focusing on sensation and pleasure rather than visual stimulation or fantasy. It helps retrain your brain to respond to real life sexual stimuli. At the end of the day, erectile dysfunction and painful sex don't discriminate. It doesn't matter if you're in your 20s, 30s, or 60s. It's not a reflection of your worth, masculinity, or femininity. Neither of them is something to feel ashamed of. The important thing to remember is that ED and dyspareunia are treatable, and taking action is the first step toward reclaiming your sexual health. Far too often, we let shame or embarrassment stop us from getting the help we deserve. But the truth is, you deserve a healthy, satisfying, and fulfilling sex life at any age. Well, our time is up for this episode of The Wisdom of Sex. If you found today's episode helpful, please give it a 5-star review, subscribe, and share it. I'd love to hear your thoughts or stories, so feel free to reach out on social media at The Wisdom Of, email me at drheatherwisdom@gmail.com, and check out my website, drheatherwisdom.com. Don't forget my new book, The Wisdom of Sex for Men, is out and available on Amazon. Until next time, keep loving and stay wise.